Today's dentists really need to be trying to make sound, evidence-based dentistry decisions in their practice on a regular basis. The problem is there's actually a dichotomy that exists to actually make this a reality in most practices. Busy practitioners rarely have enough time to actually scrub the journals to stay up on current literature. And even if they do have a little bit of time, in many situations, they cannot have access to all the different journals for various disciplines. The ability to actually apply evidence-based dentistry is very difficult. In fact, that's actually one of the reasons why we created Evidence-Based Quarterly, a resource for you to be able to stay up to date on current literature, where we kind of look through the articles for you, present to you the meat and potatoes, so to speak, of the article, so you don't have to spend a lot of time researching this for yourself. Recently in the Journal of Prosthetic Dentistry, I actually came across an article that talked about another online resource that allows you to use evidence-based dentistry to make clinical decisions. Now, the resource I'm actually talking about is a website called www.ebhnow.com. The website says it's actually a hub for evidence-based dentistry apps. So I want to take just a little bit of time to talk to you about this website and how it could benefit you in your practice. All right, let's go ahead and take a look at the website on the computer. So if you look at the website, one of the first things you're going to notice is this big picture here, and it's talking about how the website is the hub for the apps on evidence-based dentistry. What you're going to want to do is click on this button here that says Discover Our Catalog. So if we click on that, you're going to find that this website actually has a few different categories that you can utilize for your practice. The one that was actually advertised in the article was the Crown or Fill section. And oddly enough, they have two of these now. They have the Crown or Fill here, but then they have Crown or Fill Plus. I'm not really sure exactly what the difference is between these two, but I would encourage you to check both of those out just to be on the safe side. They also have a whole section for choosing whether or not you're going to use antibiotics in your practice. They have a section for using fluoride in your practice. If you have a tooth that has perio involvement and you're not sure if you want to do perio treatment or do exodontia, there's a section for that. There's also a section for endo versus extraction and implant versus bridge. There's a lot of different sections here. I would definitely encourage you just to check out each one individually and see how it may benefit you. All right, for the sake of the video here, we're going to click on Crown or Fill Plus. So we click on Continue Reading. They got some ads here. Scroll past that, obviously. You're going to get to this section here where it's going to ask you some questions about your patient and the specific clinical parameters that you see. So like, where's the tooth that needs treatment? Let's say for the sake of argument that we're dealing with a mandibular first molar. So we're going to put posterior mandible. How many dentin walls does the tooth have left? Okay, so for that specific thing, let's say for the sake of argument, we're looking at an MOD restoration with buccal and lingual walls intact. So we'll put 2 remaining dentin walls. Is the tooth vital? We'll say yes. Are adjacent teeth endo treated? Let's say yes. We'll pretend for the sake of argument that the second molar actually has previous root canal therapy. Would the site require post-extraction bone regeneration for implant placement? All right, so that's kind of an interesting question. Post-extraction bone regeneration. I mean, I guess you could base this off of maybe if there's any recession present, if there's any signs of vertical bone defects or horizontal bone loss. We'll just say no for this. All right, and then after you answer all the questions here, you're going to hit search the literature. But before I click that, this down here actually shows you some of the articles they use to generate the pathways based off your selection. All right, so if you click search the literature, here's what pops up. So for our vital tooth in the posterior mandible with 2 dentin walls left and with adjacent teeth that are endo-treated, it says the results from systematic screening of over 5,584 articles. The summary calculated from literature for a 5-year failure rate of restorative treatments. If we did an amalgam restoration, 5-year failure rate for all the resources it looked at would be 33.9% versus a 22.6% failure rate for resin-based fillings. Now, if you use just the best resources only, which they don't really elaborate on what are the best resources only or how they differ from all the resources, you can see that the 5-year failure rate is higher for resin versus amalgam. And so essentially they're giving you a tool to kind of help you clinically decide what you want to offer the patient based off evidence-based dentistry. So based off all the resources, in this case, amalgam would have a higher 5-year failure rate compared to resin versus better resources. Maybe this is randomized clinical trials, maybe it's systematic reviews or meta-analysis, but based off those resources, resin would actually have a higher 5-year failure rate. All right, so this section here, 5-year failure rate of tooth replacement treatments. So if for some reason, I guess if we're thinking about replacing this tooth with some alternative treatment option, say it had to be extracted, it's giving you some data on that as well. And so if you're going to do an implant with immediate placement, regular loading, basically 5-year failure rates 0% across the board. If you're doing implant with regular placement and regular loading, looks like there's a 5.6% 5-year failure rate compared to a 6% failure rate for best resources only. And then the bridge option, metal-based, 5-year failure rate, 3% for all resources. And for some reason, it says not applicable for best resources only. So, if you click here, expand literature references, you can kind of see that it goes into a little bit more detail and explains using the specific article where the number came from. So that's kind of interesting as well. But this is really just another tool that you can use to help you make clinical decisions. And in a world where it's not always black and white, this has a little bit more of an objective view of things. It actually asks you questions that you answer. Perhaps you do it chairside with the patient there, or perhaps you do this in the comfort of your office in the back of the practice when you're treatment planning a patient, just to see, based off of what options are available, which ones does the actual evidence support the best. All right, so that's that specific app. Honestly, this is the first time I've walked through this, and so I didn't really know what to expect. But certainly, again, an option for your practice. You can also check out some of these other areas as well. I'm not going to go into those at this time, but again, I think the creators of this, they're definitely doing this with the best intentions in mind. And I think this is a good start to what could be a more evidence-based approach for treatment planning our patients.